Hi, my name is Russ Knopp, and I'm the owner of Comfort Keepers and a proud supporter of the Hot Topic series. For the last 15 years, we have been keeping seniors safe and happy in their homes. I'd like to give a shout out right now to all the Comfort Keepers who are working around the clock to keep our clients safe and happy during this pandemic. We are proud to support the Hot Topic series in partnership with the Petoskey Chamber of Commerce. The Chamber has always been an awesome resource for us business owners. And during this pandemic, they've just stepped up their game even farther. Thank you, Petoskey Chamber of Commerce. We have Comfort Keepers. Hope you find today's presentation useful. As always, if you're in further need of assistance, please contact the Chamber. Thank you and enjoy the presentation.
Welcome to another Petoskey Strong Focus on Health. I am Nikki Devitt, president of the Petoskey Regional Chamber of Commerce, and I am joined once again by Dr. Karen DenBesten, the Infectious Disease Specialist at McLaren Northern Michigan. Thank you so much, Doctor, for joining us again. I wish you and I could do these on a light subject someday, but right now we're going to get right into it again. We just recently closed our high school in the area yesterday. We are only, a little over a week into the month of November. And my big thing that I want to speak with you about today is I would love to know, so that our community is aware and our businesses are aware, what the status of the hospital is right now when it comes to capacity and what that means going forward with our cases as they continue to climb at a rate that has been unbelievable to our county, but also to our state.
Yeah, as I'm sure everybody's aware, the numbers of COVID here in our region, in our county, and in our state, and even in the country have just grown exponentially in the last 2 weeks. It's really phenomenal how many cases of COVID we're seeing. Just to put it into perspective, yesterday the state of Michigan had 15,000 cases of COVID, the highest in the country. Other states certainly are seeing a surge as well. It's not just us, but it's here and it's spreading like wildfire. Just 2 weeks ago, one of the numbers that we look at is our percent positivity rate. That's how many cases we have versus how many tests have been done. And that gives you kind of a good indication of where you're heading. Anything over 5% would be considered just epidemic spread, uncontrolled spread. We've been doing well in Emmett County with, 1 to 2% percent positivity. And even 2 weeks ago, we were less than 1%. And I just checked, and the percent positivity rate is almost 15% now. So it's just growing exponentially. And that was 4 or 5 days ago. That the data is still catching up. I don't know what it is today. With the number of cases we've had over the past week, I'm sure it's even higher than that. The other number that we look at is cases of COVID per million population. And, we were running around 20 or so per million population, and now we're up to over 300. It just keeps going up. And this is putting a strain on everybody. Initially back in March, we saw a surge. We had good plans and we got things under control. But over the summer, things started to spread. And now we're at the point where we've reached this critical mass and it's just going up in an exponential fashion. We've been on this treadmill now for 9 months, and it's just going faster and faster. And at some point, we can't keep up anymore. And we're there. We do have good capacity in the hospital. We do have good surge plans that we've implemented. We know what to do. We're very good at taking care of COVID patients now. We have the ability in a respiratory isolation unit to open up more area of the isolation unit to expand and contract as needed. And we've done that. We've expanded our respiratory isolation unit twice. But the problem that we're running into now is healthcare workers are getting sick, or we're falling ill, and we don't have the staff to take care of people anymore. And we're having to divert patients to other healthcare facilities for that reason. I don't think the transmission is happening in the hospital, but I do think people are getting careless and getting out, and spreading is happening outside of work, and we just don't have the staff and the healthcare workers now to care for all the patients that are rolling in.
And one of the things that you and I have talked about too is that early on, part of the, when we first shut down and everybody was speaking about, why we were doing what we were doing and the extreme measures, it was in protection of our healthcare workers, not just so they didn't get COVID, but because of the fact that we have to look at a standpoint that our hospital, for example, does not have the capacities that a larger Southern Michigan hospital has. So while they may be having more patients, we have to look at it and say, well, how many beds do we have? How much can we do? And where do we go from here? And if we're exhausting our healthcare workers, if we're at the limit with COVID patients, then there is you start talking about car accidents, other illnesses, things that are going on. And that we heard that so early on. And I think maybe people forgot about that it isn't just, people don't just have COVID to go to the hospital. There's many other reasons. And we have to have the, availability to take care of people.
We need to be able to
important.
take care of all patients. And
right.
I think the difference back in the spring versus now is when we were on full lockdown, we were canceling elective surgeries or non-necessary surgeries. So we had a little bit more availability. That's not happening now. We're taking care of patients with all kinds of medical emergencies, as we should, in addition to the COVID patients, and the resources are getting very strained doing that. We can knock this down, and we can get the numbers down, and we have done it, and we did it. We need to get back to that mentality. Even though we're all tired and we have COVID fatigue, we know what needs to be done in order to prevent and slow the spread of this. By doing that, we're going to allow the healthcare workers, to get healthy, to get well, to catch their breath, so they're able to take care of all the patients. And we need to get back to the basics. It can be done, but everybody needs to work together. We're all in this together. There is a long, long ways to go here. We're in it for the long haul. There's really unlimited capacity and ability of this virus to spread. If we think it's bad now, it can always get worse, and it will get worse unless we intervene and do something.
Absolutely. And that's, we wouldn't have thought we knew it could get worse a couple of weeks ago, but here we are 2 weeks later saying this is unbelievable how exponential it's gotten and how fast it's growing. And yet again, it comes back to the fact that we have the power as individuals and as communities to absolutely, as you've said many times, crush the curve. We have it, we've done it. And it's the simple act of wearing a mask, keeping your distance, washing your hands, and using common sense when you are out and you are out in public and doing those things that you need to do. We want to keep our economy going. We know the vital importance of that. And we're tired of masks, but it really, at this point, truly doesn't matter for what we are seeing now. If we think that it won't get much worse, we're fooling ourselves, correct?
There is so much room for it to get worse. If you think at this point, maybe 10% of the population has contracted COVID, there is a long ways to go, and it can get so much worse. We're starting this next surge and wave off at a higher baseline with more people infected. So there's so much more room for it to grow. But the good news is we have the resources and tools, and I can tell you exactly what to do to prevent the spread. It's just that simple. And it's going back to the basics. I feel like a broken record, but everybody's heard it over and over what needs to be done. Wearing the mask. You wear the mask and it prevents the transmission of COVID. If everybody wears the mask, we can prevent the transmission by 80%. This is a mask. That's all it is. It's not a political statement. It's nothing. It's a mask. It's a healthcare tool to prevent the spread of COVID, and it's that simple. These save lives. By wearing this, you might not realize it, but you are saving lives. People might not realize it or see it. They don't see the people in the hospital, the lives lost from COVID, but it's real and it's happening. And your actions prevent the spread to somebody who may spread it to somebody's, grandparents or family, and they don't see that the harm they're doing by not taking these preventions to prevent the spread.
And it's absolutely just that. It's not, it's just a tool. That's all it is. It's a tool. My wearing it doesn't mean I'm fearful. It doesn't mean I'm what my political stance is. It means nothing other than the fact I'm not afraid of COVID for me. I'm afraid of infecting someone else. I'm afraid of my transmitting it to someone who might infect someone else. And, it's, my coworker's mother or however that works. Those are the things that I'm fearful of. And I think that we all need to remember that it isn't about you, just you. It's about how that transmission works and who you interact with. And especially thinking of that scenario with the holidays coming, with Thanksgiving coming. I know our family, we're not going anywhere. No one's coming over. It's just us, 4 people and a 15-pound turkey. Well, maybe we'll make it a little smaller this year, but the point is that's what we're going to do.
The spread that we're seeing right now, the transmission is not happening in the hospital. We're taking the precautions. Everybody has been dialed in with the masks, the eyewear, the hand washing since March. And it's not spreading in the hospital. It's spreading in the community. It's spreading when people are being careless, letting their guard down, getting together, small gatherings, restaurants, bars, masks off, talking close together, extracurricular activities, small gatherings. That's why I'm particularly concerned about the holidays coming up with Thanksgiving and Christmas get-togethers with grandma, small gatherings. This is where the transmission is going to happen. And it's going to be a long, painful, hard winter with a lot of hurt for everybody if we aren't careful. We have to think creatively and figure out how to include families in gatherings without being close and getting together. It might be sharing recipes and Zoom meetings. I don't know, but that's where the spread is going to happen. Small gatherings. People think, well, it's just 10 people in their family. Well, one of them could have COVID asymptomatically and not realize and spreading it to others. These small gatherings are where the transmission is happening now.
Yeah, and it's where we have to put our foot down. And it's also not the schools.
It really isn't. I think the schools are doing an amazing job of everybody's wearing a mask. They're doing what they need to do. The reason the schools are closed now is because the reason why the hospital is diverting patients, because we don't have enough healthcare workers or educators to do what needs to be done, because everybody's falling ill and getting sick.
Yeah, and you can look around at your small businesses too, and there are several that are also doing the same thing, that have chosen for preventative reasons, but also for forced reasons to go to curbside takeout, online ordering again. And it's a staff issue as much as staffing's always been an issue. It's also the COVID form of staff issue, which is so-and-so's taking care of so-and-so, so-and-so's quarantined. We don't want anybody in right now because the numbers are where they're at, and that's just it. I think from a business standpoint, we've had a couple businesses, say, am I right to go online again right now? And I wholeheartedly say, if you can operate your business in a safe and functional way financially, and you feel online is better for you and your staff while we're in this position, that absolutely is, something you can and will do. And we hope you do, to take those, extra precautions where needed.
I've said it from the beginning, we can do this and we can keep seeing patients and we can stay in business and keep the economy going, but we have to be smart about it and figure out workarounds. We all know at this point how it's transmitted. It's a respiratory illness predominantly. So by wearing the mask, keeping the distance, and not having large gatherings, and figure out how to do business with those, set of rules, we can keep going, I think.
Well, I hope the next time that you and I check in the next week or two, we're not talking that the treadmill is going faster. I hope that we're at least baselining a little bit.
Well, we're in this for the long haul, and I think it's obvious that the numbers are going up, and this is nowhere far from over, nowhere near over. But the good news is that we know how to prevent the spread. We need to do it. And also there is some good news too about vaccination development,
Yes.
which is fantastic.
Yeah,
That's what's going to be necessary in order to stop this completely. And Pfizer has a vaccine that has been shown to have some good efficacy. The safety data is still out, but we're hopeful that can be available hopefully at some point in the next several months. That certainly will not change the fact the virus is still out there spreading, and our people are at risk, and we still need to take these precautions really for the unforeseeable future.
Right. And we just have to remember that, I think we've said this before, this is a marathon. We're in for the long haul, and we know how to do this right. And right now we're at a very crucial point in our healthcare system locally here and throughout the state and country. And it's our responsibility to make sure we keep all of you safe so you can take care of us.
And I will point out, we're smarter than this. We know what to do. We need to look out for each other, be kind for each other, kind to each other, and just be smarter than the virus. This virus preys on weakness and opportunity and stupidity. And
And we're smarter.
And we're smarter than them.
Thank you so much, Dr. DenBesten. I
Thank you.
appreciate your time very much. And I look forward to speaking with you again. And hopefully we'll just keep going and we'll keep saying it. I know we sound like a broken record, but I think it does help for our community and our businesses to have that perspective and reminder that we are capable. And as you said, we are strong enough. We're Petoskey strong. We can do this.
We're strong, and we look out for each other, and we come together as a community, and this is what we need to do.
Thank you.
We can get there. Mm-hmm.